So which of the following is the most important in determining the prognosis of a patient with melanoma? The location, the depth, the presence or absence of ulceration, the, the duration of the melanoma, or the surface size of the melanoma? Good. Yeah, I mean, the depth is the correct answer here. That's really important. So, in terms of melanoma, what I'd say is that I think everybody knows about the ABCD, and you can see here an example. This is asymmetric. The borders are irregular. There's color variation. It's bigger than 6 centimeters and 6 millimeters, and it also seems to be elevated in certain areas. So this would be a high suspicious for melanoma. By the way, melanoma, in contrast to basal cell and squamous cell, is very interesting. So melanoma is really the main cause of melanoma is actually skin burn. So if you get skin burns, that's the big risk factor for melanoma. For basal cell and squamous cell, it's really duration of exposure, which is interesting. Just to be aware of that. So the prognosis is really the depth is the main thing. You can see a big difference here between if it's less than 0.76 millimeters versus greater than 3.6 millimeters, a drastic difference in their survival. And that's what you need to know. That's the most important thing to know. A couple other things to be aware of in terms of treatments: be wide local excision. You may or may not do a sentinel lymph node dissection. But I think the key thing to know for the boards is also this BRAF, right? BRAF, this mutation actually is gotten routinely and helps to dictate my treatment. I don't think you need to know the treatment and know which ones to use. I think you need to know that BRAF is highly associated with this and actually dictates which treatment they'll get. So know about that BRAF mutation. In terms of how wide the margin should be, I think this is nice to remember, very easy to remember here. So in situ, of course, would be 0.5 to 1, but these other three, you notice, just convert millimeters to centimeters. So if it's less than 1 millimeter, it'll be a centimeter. Again, 1 to 2, it'd be 1 to 2 centimeters. Greater than 2, it'd be 2 centimeters. So easy to remember. Just think about converting tumor thickness to surgical margin, and that'll help you remember that.